Hey, hello, good afternoon, everyone, and welcome to yet another Tooth Talk with your dentist with me, Dr. Rekha. And thank you all for joining me and all my other friends in this conversation on oral and dental health. I would like to thank one and all of you and all of my friends who have been a part of this oral health campaign. We have done some talks with you till date, but I thought today I should probably talk to you about some most one of the most common causes why anybody would visit a dentist. Yes, and that's the tooth pain. I think tooth pain is one of the most common causes why anybody would go to a dentist. I think otherwise nobody would even bother, one small little some sensitivity here or some chipping off of tooth there. I think you would not bother to go and visit your dentist unless there is that excruciating pain that disturbs your sleep at night. So, in today's session, let's try to understand some facts about what tooth pain or pain related to the mouth and jaw is all about. So, welcome yet again. Tooth pain can be broadly classified as pain that originates because of some problem with the tooth or structures associated with the tooth, and it can be another factor is the tooth pain that occurs because of any other related factors like an improper done filling, or if there is a prosthesis or a bridge or a cap that is not fitted properly in the mouth, or because of any problem that is associated with the mouth or jaw associated structures like your temporomandibular joint or the TMJ, and then the muscles associated with the jaws and the ears or the sinus, and sometimes even obstructive sleep apnea can cause some kind of discomfort for you all. So since the subject of tooth pain is so vast and there is so many factors and so many reasons that has to be covered, what I will do today is I will talk tooth pain that originates because of the tooth, which is the most common cause of tooth pain among most of the people. So I hope I'm audible there. Yeah, okay. So today in today's talk I will be sharing with you information on why you could have a tooth pain because of an infection or a damage that originates within the tooth or with the structures that are closely associated with the tooth. So like most of you, like you've known, the most common cause would be a tooth infection that happens in the tooth because of a tooth decay. Now, decay is a process. It is a bacterial infection of your tooth where the bacteria attack your teeth, dissolve the hard structures, and then go on to infect or damage the pulp where there are nerves and blood vessels present. So when this infection reaches the pulp, that is the inside portion of the tooth, that is when you could have a tooth pain. Now, another reason is because of a gum infection. A gum infection happens when there is a damage that happens to the structure that surrounds the tooth, which is your gums and the deeper layer of the gums, which we call as the periodontal ligament. Then further on, this infection can go up to the bone, which can cause a severe tooth pain. This is another cause. Now, one more reason why you could have pain associated with the tooth is when there is a wisdom tooth. When there is a wisdom tooth that is not erupted properly in the mouth, and we did discuss about this in the previous sessions about how a wisdom tooth which is impacted, a molar, can cause pain and swelling and discomfort like difficulty in jaw opening and all those symptoms. So this is another reason why you could have tooth pain. Now, another reason is severe sensitivity in the tooth. Now, again, sensitivity is a topic that we did discuss. So, you can please go through our videos in the group and you will get information on all of these topics. So, tooth sensitivity, which goes to the severe form, which means it is close to an infection of the tooth, can also cause pain. Now another reason is bruxism, or clenching of your teeth, or knife grinding. So because of this, there is wearing out of the teeth, and again it can cause pain in the tooth and the related structures. So sometimes what happens is when people undergo a clip treatment, or what we call as an orthodontic treatment, because of the pressure that is applied in creating the tooth movement, or in correction or straightening of your teeth, there can be some amount of tooth pain that occurs. And of course, this is a very transient or a temporary kind of a tooth pain. Now what happens is when there is an infection in the tooth or the gums, there forms what we call as an abscess or a swelling in the gums. So when this happens, you could have a tooth pain. Now some conditions like acid erosion, where the tooth is worn off because of dissolution, because of the action of very strong acids, this can cause some amount of infection in your tooth, and you can have or you can experience some amount of tooth pain. Now another reason why you can have pain in the mouth or in the related structure is what we call as a cold sore or aphthous ulcers. Because of these also you can have some pain. So very generally, just giving you a broad outline on what the reasons for tooth pain could be. Now what exactly would you feel when you have a tooth pain? Now when you have a pain in the tooth, of course it is a pain. It is a very severe pain, especially if it's of tooth origin. Now this generally patients come to us and complain that they have this pain which increases during the night. Now you can also have pain during chewing of any soft food, or even hard food or soft food. Then there could be bleeding from the gums, or there could be pus discharge from the gums. You can also notice a swelling around the tooth, inside the mouth, in the gums, or sometimes if the infection is within the tooth, which we call as the pulpitis, which occurs because of a tooth decay. There can also be an extraoral or a swelling that you see outside the mouth in the jaws. Now when should you go visit your dentist? Of course, I think most of our patients are really very smart people, so I think they first go to the pharmacy, pick up their own painkillers. They do all possible house remedies which their grandmother would have written down somewhere. You would have done all of it, and I think only when the pain does not subside, at that point is when you will visit the dentist. Of course. So what we would recommend is that, of course, when you have a pain that is more than 24 to 48 hours, please do visit your dentist, because this is the kind of pain which will not subside with any of your house remedies. If you notice a swelling in your gums, please see your dentist immediately. If you have continuous sensitivity in your tooth that is not subsiding with any of your desensitizing paste or any of your clove oil or any of those remedies, please see your dentist, because there could be something more to this sensitivity than just what you think it is. Now one reason why you should also see your dentist immediately is if you have any difficulty in opening your mouth. And if you notice any broken teeth in your mouth, for whatever reason the tooth is chipped off or broken, and if you have any pain associated with that tooth, please see your dentist immediately. Now what would your dentist do? How will your dentist decide and tell what your tooth pain is because of? As dentists, we do a series of tests. Of course, we do a physical examination of your tooth. We do a thorough checkup of each and every tooth to find out which tooth is causing you the tooth pain. So we are trained to do that. So we try to figure out with clinical examination, with physical examination, what the reason for the tooth pain could be. And of course, we have dental x-rays available to us. We have intraoral x-ray, periapical x-rays, which are small little x-rays that you possibly would have seen. So generally, as a first round of our tests, we do these small radiographs, x-rays, and find out the local factors for a cause of the tooth pain. So sometimes we may need what we call as an OPG or a large X-ray, which gives a complete picture of the entire mouth to us. So at such times, we could advise you to get a bigger X-ray to check the condition of the entire gums and the bones. And of course, we could, if we detect, if we feel that there is some kind of a problem with your tooth pulp, that is, if there is an infection in the pulp, and we need to understand if the pulp is still living, if the nerves are still active or not, we could probably do what we call as pulp vitality tests. So once we do all the tests and considering the symptoms that you tell us, we will be able to come to a diagnosis and tell what the reason for the tooth pain could be. Now, of course, treatment options are varied depending on the origin of the infection. So if it is a pulpal infection or an infection that is because of a tooth decay and the infection has gone on till the pulp, most of you are aware today that we would do a procedure called the root canal treatment to get rid of the infection within the tooth. Now, if the infection is in the gums, suppose you've had a bleeding gums that is ignored, and then the bleeding gums has gone much deeper and it has caused infection in the bone, and in such a case we would do what we call as a scaling, root planing procedures. That is basically cleaning out of the gums, and probably your dentist could call on the specialist who is a periodontist or a gum specialist, and they could in all possibility do some laser treatment to clean your gums. So most of the time when these procedures are done, your pain will subside completely and you will be fine and you will be able to chew and eat well on that side. Now, what can we do to prevent tooth pain? Because for one thing, any infection that is happening in the mouth is something which is under your control. So if there is a tooth decay or if there is a gum infection, it is well under your control how well you can keep these infections at check. So to a large extent, preventive care is more important to avoid a tooth pain. So what are the steps or what are the things that you need to do in these preventive care as a part of the preventive care measure? First of all, we would all say this repeatedly, and it is for your good we say this. Please visit your dentist regularly for your checkup. Say once in 6 months for a checkup. Your dentist will check the condition of all your teeth, will check your gums, and if he detects any decay or any damage that is happening to the gums, which is at the initial stage, you will be told immediately about it. So ensure that you visit your dentist regularly, get your checkup done, and ensure that if there is a decay that is just developing, you put it under check by getting a very simple filling done. Or a routine scaling or a tooth cleaning procedure goes a long way in preventing severe gum infections for you. Now, along with these, your dentist may also do a couple of x-rays if he has a doubt that there is some decay in some area and he's not able to probably clinically detect it, or he kind of needs a second opinion on it. Your dentist may do what we call as an intraoral periapical radiograph, IOP x-ray, and try to find out the condition of the tooth and gums in that area. So a routine checkup goes a long way in preventing any severe damage happening to your teeth. That is the first and the foremost thing. And secondly, your brushing and flossing, your everyday brushing and flossing is a must. These are the basic procedures for a plaque control measure. So along with brushing, flossing is important because the areas between the teeth which are inaccessible to your regular brush have to be cleaned with the help of interdental aids, which are either your dental floss or your interdental brushes or maybe even oral irrigation devices. But nonetheless, it is important that you brush and floss regularly twice a day. This is an instruction I think every dentist would give to his patient, but you should understand that this goes a long way in preventing gum diseases and tooth decay. Now, there is another aspect which is important in preventing tooth decay, and that is fluoride. Now, fluoride is an element that is present in water bodies and in all probably all sources that thrive on water. So what happens, what exactly does fluoride do? Fluoride is an element that combines with your tooth structure and it forms a much stronger crystalline structure, that is a stronger tooth structure which is more resistant to the acid attack by the bacteria. So that is exactly how your fluoride strengthens your teeth. So using water that is fluoridated to the optimal level, or using toothpastes that are fluoridated, or using mouthwashes that contain fluoride in it, help you to a great extent in building that surface layer of the tooth which is much stronger and more resistant to a tooth decay. Now, another reason for your tooth decay could be tooth injury. Like I said, a fractured tooth or a chipped off tooth. I did talk about a fractured tooth or a chipped off tooth in my previous session. You can please check that video in the group, or I'll share the link to all those talks towards the end of this talk, and you can go through those topics to get a better understanding of those topics. So even when there is a cracked teeth or a fractured teeth that is causing some pain. Now this fracture of teeth can happen generally during contact sports. So it is important that you wear a sports guard when you play rugged team games. So you can visit your dentist. He will fabricate a sports guard for you, and you can prevent a lot of damage that happens because of a injury to a tooth. Now, people who have bruxism, you can wear a protective mouth guards or night guards. This again, your dentist will fabricate it for you, and you can wear it during the night, and to a great extent take off the load that is happening on the teeth. Now, so broadly, these were why you could have a tooth pain, and why preventive measure is the key to preventing a tooth pain. So don't forget, if you think your dentist is just saying it, because he wants to see you more often, no, that is not the case. We say this for your good, that you have to visit your dentist regularly, get your routine check done, so that you don't have to experience a tooth pain ever. So if you like this video, do click on the like button, and do share your comments, your concerns. Do write to us in the comment section below, and we will get back to you on this. And there are a lot more topics that people have been asking us about, and eventually we will cover those topics in the subsequent talks. So I guess that is it for today. Next week, another colleague of mine, another good friend of mine will join you and share with you some more information on your oral and dental health. Till then, you take care and stay tuned with us. Thank you.